Welcome to the Phlebotomy Study Podcast. Phlebotomy is the clinical practice of drawing blood from patients for laboratory testing, transfusions, research, or donation. It is one of the most essential and frequently performed procedures in modern healthcare, a small act that carries enormous diagnostic power. At the heart of this practice is the phlebotomist, a trained healthcare professional whose skill, precision, and compassion make the difference between a routine blood draw and a life-changing diagnosis. Phlebotomists work in hospitals, clinics, diagnostic laboratories, blood banks, and community health centers, serving patients of all ages and backgrounds. They are often the first healthcare worker a patient encounters, making their role not only technical but deeply human. Beyond the needle and the vial, phlebotomists are guardians of accuracy. The quality of a blood sample directly affects the reliability of test results, and those results guide the decisions doctors make every day. From detecting diabetes and anemia to screening for cancer and infectious disease, the work of a phlebotomist quietly supports the entire diagnostic chain of medicine. This podcast is your dedicated study companion on the journey to understanding phlebotomy, its science, its standards, and its significance. Whether you're preparing for certification, refreshing your knowledge, or exploring the field for the first time, you're in the right place. Let's get started.
Phlebotomy Educational Dialogues. Real-world scenarios for California Community College students. Section 1. Communication. Dialogue 1A. Building trust through effective communication. Setting. Outpatient laboratory morning shift. Characters. Maria, experienced phlebotomist. Devin, phlebotomy student. Mrs. Chun, elderly patient anxious about blood draw. Scenario. Devin. Good morning, Mrs. Chun. I'm Devin, a phlebotomy student, and this is Maria, who will be supervising today. We'll be drawing your blood for the tests your doctor ordered. Mrs. Chun. Nervously. Oh, I hate needles. I always get bruises. Can't we skip this? Maria. Sitting at eye level with patient. Mrs. Chun, I understand needles can be uncomfortable. Many people feel the same way. May I ask what concerns you most about the blood draw? Mrs. Chun. Last time, the person stuck me 3 times and my arm was black and blue for a week. Devin. Making eye contact. I'm sorry that happened to you. That must have been really frustrating. Maria. We're going to take extra care today. I'll examine both arms to find the best vein, and I'll only attempt the draw when I'm confident I can do it successfully. Devin here is learning, but I'll be the one performing your draw today. Is that okay with you? Mrs. Chun. Relaxing slightly, yes, that helps. Thank you for explaining. Devin. Mrs. Chun will also make sure you're comfortable. Would you like to lie down or sit in the chair? Mrs. Chun: the chair is fine. Can you tell me when you're going to stick me? Maria: absolutely. I'll walk you through each step. First, I'm going to apply the tourniquet, this band around your arm. You'll feel some pressure. Then I'll feel for your vein. I'll clean the area, and I'll tell you right before I insert the needle. Does that sound good? Mrs. Chun: yes, thank you. You both seem very caring. Key learning points. Active listening builds trust and reduces patient anxiety. Acknowledging patient concerns validates their feelings. Clear step-by-step explanations help patients feel in control. Sitting at eye level demonstrates respect and equality. Asking permission shows respect for patient autonomy. Dialogue 1B. Communicating with a hearing-impaired patient. Setting: hospital laboratory afternoon shift. Characters: James, phlebotomist. Sarah, phlebotomy student. Mr. Rodriguez, patient with hearing impairment, wears hearing aids. Scenario: James, approaching patient, notices hearing aids. Good afternoon. I'm James and this is Sarah. We're from the laboratory. Mr. Rodriguez: cups ear. What? I can't hear you very well. Sarah starts to raise voice. We're here to you. James gently touching Sarah's arm, turning to face Mr. Rodriguez directly. Mr. Rodriguez, we're here to draw your blood for testing. Mr. Rodriguez reading James's lips. Oh yes, my doctor told me about this. James maintaining eye contact. May I see your wristband to verify your information? Mr. Rodriguez shows wristband. James showing requisition, pointing to name. Is this you? Manuel Rodriguez. Date of birth March 15, 1952. Mr. Rodriguez: yes, that's me. Sarah quietly to James: should I write things down? James to Sarah: good idea. Some patients prefer that, but let's ask first. To Mr. Rodriguez: would it help if we wrote down the instructions, or can you hear me when I face you? Mr. Rodriguez: I can understand you fine when you look at me. Just don't turn away when you talk. James: perfect. I'll make sure to do that. Facing patient: I'm going to draw blood from your arm. Have you had blood drawn before? Mr. Rodriguez: Many times. I'm used to it. James. Great. Showing items. I'm going to use this tourniquet. Clean your arm with this alcohol pad. And use this needle to collect the blood in these tubes. You'll feel a small pinch. Is there anything you'd like me to explain? Mr. Rodriguez. No, go ahead. Thank you for being so patient with me. Sarah. After procedure, I almost made a mistake by shouting. Why is that wrong? James. Shouting can feel demeaning and doesn't help most people with hearing loss. It distorts your mouth movements, making lip reading harder. Instead, face the patient, speak clearly at normal volume, use visual aids, and check for understanding. Every patient deserves dignified communication. Key learning points. Face patients with hearing impairments directly when speaking. Don't shout. Speak clearly at normal volume. Use visual aids and written materials when helpful. Maintain good lighting so patients can see your face. Be patient and willing to repeat information. Treat all patients with dignity regardless of disabilities.
Medical Dictionary for Phlebotomy Students. Section 1. Anatomy and Physiology. 1.1 Cardiovascular System. 1. Artery. A blood vessel that carries oxygenated blood away from the heart to the body tissues. The phlebotomist must avoid puncturing an artery during venipuncture, as this can cause excessive bleeding and patient discomfort. 2. Vein. A blood vessel that carries deoxygenated blood from the body back to the heart. The median cubital vein is the preferred site for routine blood collection because of its size and accessibility. 3. Capillary. The smallest blood vessel where exchange of oxygen, nutrients, and waste products occurs between blood and tissues. A capillary puncture is performed on infants and when only small amounts of blood are needed for testing. 4. Antecubital fossa. The triangular area on the anterior surface of the elbow where the most common veins for venipuncture are located. The phlebotomist palpated the patient's antecubital fossa to locate the median cubital vein before inserting the needle. 5. Median cubital vein. The vein located in the middle of the antecubital fossa, preferred for venipuncture. The median cubital vein is typically the first choice for blood collection because it is well anchored and less painful to access. 6. Cephalic vein. A vein located on the thumb side of the arm, used as an alternative site for venipuncture. When the median cubital vein was not accessible, the phlebotomist used the cephalic vein on the lateral aspect of the arm. 7. Basilic vein. A vein located on the pinky side of the arm, used cautiously due to proximity to nerves and arteries. The basilic vein should be used with caution because the median nerve and brachial artery lie nearby. 8. Hemostasis. The process by which the body stops bleeding through blood clotting. After removing the needle, applying pressure to the site promotes hemostasis and prevents hematoma formation. 9. Plasma. The liquid portion of blood containing water, proteins, nutrients, hormones, and waste products. Plasma makes up approximately 55% of total blood volume and appears as a clear, yellowish fluid when separated from blood cells. 10. Serum. The liquid portion of blood that remains after blood has clotted, without clotting factors. Many chemistry tests require serum samples, which are obtained by allowing blood to clot before centrifugation. 11. Erythrocyte, a red blood cell responsible for carrying oxygen throughout the body. The erythrocyte count measures the number of red blood cells per volume of blood and helps diagnose anemia. 12. Leukocyte. A white blood cell that functions in the immune system to fight infection. An elevated leukocyte count may indicate the presence of infection or inflammation in the body. 13. Thrombocyte. A platelet, a cell fragment essential for blood clotting. Thrombocytes aggregate at the site of vessel injury to form a temporary plug and initiate the clotting cascade. 14. Hematocrit. The percentage of blood volume occupied by red blood cells. The patient's hematocrit was 38%, which is within the normal range for adult females. 15. Hemoglobin. The oxygen-carrying protein found in red blood cells. Low hemoglobin levels indicate anemia and may cause symptoms such as fatigue and shortness of breath. 1.2 Other body systems. 16. Dermal. Relating to or affecting the skin. Dermal puncture, also known as capillary puncture, is performed by making a shallow incision in the skin. 17. Epidermis. The outermost layer of the skin. During a finger stick, the lancet must penetrate through the epidermis to reach the capillary bed beneath. 18. Dermis. The layer of skin beneath the epidermis containing blood vessels, nerves, and connective tissue. The dermis contains the capillaries accessed during dermal puncture procedures. 19. Subcutaneous. Located or placed beneath the skin. Subcutaneous tissue lies below the dermis and should not be the target during capillary puncture. 20. Lymph. Clear fluid containing white blood cells that circulates through the lymphatic system. Lymph nodes may become swollen during infection as they filter bacteria and other harmful substances. 21. Edema. Swelling caused by excess fluid trapped in body tissues. Venipuncture should not be performed on an arm with edema because the excess fluid can dilute the blood sample. 22. Palpate. To examine by touch, especially for medical diagnosis. The phlebotomist must palpate the vein to determine its depth, size, and direction before needle insertion.